So we're now ready to move on to presentation. Item number 2, Jamie Michael. This has to do with the transition from the Seoul Community Hospital program to the newly proposed program, which has a number of different names.
Correct. Good morning, Commissioners. Jamie Michael with the County's Health and Human Services Department. We are here today to talk about what is formerly known as Seoul Community Provider, and I think the name that is now catching on is the Safety Net Care Pool. This is probably the first of several conversations we will have about this topic as we move forward. So I just wanted to lay out some of the kind of the history so we know where we were coming from. The Seoul Community Hospital Program, as you all know, is a federal program that was developed, I believe, in the early 90s to help hospitals in rural communities exist. So there was a point of access for people in rural communities. A lot of the more rural communities may not be a very lucrative place for hospitals to set up shop, so we want to, the federal government wanted to make sure that they were able to provide some financial assistance so some of these hospitals would choose to go into these communities and be viable for the residents in those areas. So we've had that program here in our county. It's been very successful to help both of our hospitals, mainly Memorial Medical Center, because they do see the overwhelming majority of the uncompensated care or the people who qualify for the county's indigent program. In the current fiscal year, across the state, the amount of money available for all the hospitals was decreased by 70%. Part of this was some discrepancies between how our state was using the money and also the rollout of the Affordable Care Act and some of the changes in the system as a whole. So there was a tremendous decrease in the amount of money available to the hospitals. Again, most of that reduction was felt by Memorial Medical Center in the current fiscal year. The county did make our match. We matched with $4.7 million for the current fiscal year. And as we move into fiscal year 15, there will be no county match for the Seoul Community Program because it is over. It no longer exists. So the new program, which is the Safety Net Care Pool, includes an uncompensated care dollar amount that was negotiated between the state and the federal government, the Center for Medicaid Services. That money will be distributed to hospitals in the state based on the amount of uncompensated care that they provide for their communities. Hospitals will also be reimbursed under a hospital rate increase, and this will be based on the number of Medicaid claims that they submit to the state. So instead of receiving a fixed amount of money under Seoul Community Provider, they will now receive an increase in the amount of reimbursement they get for each claim. So it's more of a fee for service. The state is just going to give a better reimbursement rate on Medicaid claims than they had in the past. The way the Safety Net Care Pool and the hospital rate increase dollars will be distributed to the hospitals is still in negotiation. The state Human Services Department is working with the Center for Medicaid Services and also the New Mexico Hospital Association to figure out the best way to distribute this money back to hospitals. So we've seen some preliminary dollars and some preliminary systems, but I know that there is still some discussion. The most recent information that I received directly from Human Services Department shows that Mountain View will receive an increase in the amount of money because they will be able to pull from that uncompensated care pool of dollars. Memorial will receive a fairly dramatic decrease because they're listing them as a larger hospital, and originally we're not allowing them to take funds from the uncompensated care pool, and that was they were looking at all the large hospitals in the state, which includes Memorial, the hospital in Santa Fe, and the hospital in Farmington. All three of those hospitals went back to the New Mexico Hospital Association and said, we may be a larger hospital, but we are still seeing the majority of uncompensated care, so we need to renegotiate how that's going to be distributed back. And I think they successfully were able to communicate that with Human Services Department, and so we should see some changes in how that money will be redistributed back to the hospitals, and we will keep an eye on that because we want to make sure that Memorial serves as the county hospital and does take care of the majority of uncompensated care, so we want to make sure that they are able to continue those services. The funding from Human Services Department, their main goal for funding this new project, they need to make sure that the amount of money is consistent and is a dedicated revenue stream. So the past system, counties were able to determine their match each year, and it could change. That's not going to work for the new program. It needs to be a consistent amount for several years, and it needs to be a dedicated revenue stream. So that's why we can't use the old way of funding it for the new program. We do not need our local match after this current fiscal year, so the state requested financial assistance from the counties to help put together the total funding for this new program. During this past legislative session, there was a bill carried successfully by Senator Nancy Rodriguez, and I think if you all know her or run into her, we all need to give her a big thanks. She was a great advocate for the counties. She previously was the director of the Indigent Services for Santa Fe County, so she understood the issues, and she did a really great job of advocating for counties. It originally started as Senate Bill 368, but it ended up being several committee substitutes for that bill. Some of the highlights in that legislation: counties are going to be required to pay the equivalent of 1/12 of the current gross receipts tax. The state is required to fully fund the program, which is good news because they wanted more money from the counties to fully fund the program. Counties were able to compromise with the 1/12 contribution, but as I was informed yesterday by Dave Kimball, who was one of the lobbyists up in Santa Fe, Howie Morales was able to put a last-minute amendment onto that legislation and is requiring the state to fully fund the entire program for at least the first year, regardless of how much money counties contributed. So at least we know that for the first year, the hospitals will be, or the state as a whole will be receiving as much as possible under this program. The source of our 1/12 contribution can be determined by the Board of County Commissioners. It has a 3-year sunset, so we're only committed to doing this for the next 3 years. And included in that is also some additional tax authority without referendum, which is important for a lot of counties that don't have enough of their indigent gross receipts tax to cover this, plus all of the other things that counties are mandated to do. So there was some additional tax authority offered to counties under this legislation. There's some other content that was changed with the original indigent care statute. They removed the 3-month residency requirement. They're also allowing counties to use some of the indigent funds to assist with health insurance premiums or other out-of-pocket costs as people are purchasing insurance on the exchange and still may have barriers to care because of the out-of-pocket costs for the individuals. It's going to transfer this money into the Safety Net Care Pool, which is a different fund, and I think that's important. They're not going to commingle this money with some of the other Medicaid dollars that counties are required to contribute. So it's going to be a standalone fund for this money, and it cleans up the language because the phrase sole community hospital provider was all over the legislation, so they had to remove that language and replace it with Safety Net Care Pool. So as we move forward under the new legislation, we are going to have to figure out as a county how to address our safety net contracts. We are looking at all of the gaps in service. So people who are now covered under the Medicaid expansion, who are going to be able to purchase insurance on the exchange, there are still gaps in the types of care that they can receive. So we're trying to figure out what gaps the county's indigent program needs to come and fill so people can still have access to comprehensive health care. We also know that there are some people that are going to remain eligible for the county's indigent program, so we're going to have to use our contracts and our providers to make sure that those people still have access to the services. We're going to have to revise our resolution so it aligns with the new legislation. We will have to determine the source of where the 1/12 will come from. It's going to be approximately $3 million. I've seen anywhere from 2.7 to 3.4, depending on the estimates of the gross receipts tax. And one thing I'm trying to find answers to right now is the bill had an emergency clause in it, so it becomes effective on the date of signature. I don't know if that means that they will start requiring our payments this fiscal year, or if our payments are not going to start until next fiscal year. So Steve Kopelman with NMAC is trying to get some answers for me, and we've also we're waiting on an email response from the Human Services Department. This is a little concerning because we've already paid $4.7 million for this current fiscal year, so the money's spent this current fiscal year. So the county manager and I spoke about making sure that the state understands that probably most counties have already contributed to Soul Community this current fiscal year. So having the 1/12 contribution to the safety net care pool is probably much more feasible to happen starting the new fiscal year. I can try to respond to any questions. Again, things are changing. The presentation that was in your packet is different than the one today because even as of yesterday I was getting new information. But if you have any questions, I'd be happy to try to address them.
Thank you. Questions? Let's start on my left.
No questions, thank you.
Mr. Hancock, any questions?
Thank you, Mr. Chair. Thank you for the presentation. A couple of questions. We're replacing. Do I understand we're replacing Soul Community Provider, the name, with the Safety Net Health Program?
Yes, the name and the program. It is still part of a federally funded program. It's still approximately 3-to-1 financial match for the state, but the mechanism is also different. So it's not just a new name. It's a much different mechanism for distributing dollars to hospitals.
I understand. How does this interface with the Centurion plan?
The Centennial? The
Centennial,
okay.
Yes, I'm sorry.
I thought, oh no, there's a new one I don't know about.
Starts with a C.
Yes. Yeah. This is part of Centennial Care. Human Services Department is developed this in conjunction with Centennial Care. So the base rate increase for hospitals is based on Medicaid claims. The hope is that more people will be covered under the Medicaid expansion under Centennial Care. So all of the MCOs that participate in Centennial Care will have to reimburse the hospitals at a higher rate. So that is one of the ways that they are going to look at maintaining some funding for hospitals since Soul Community went away. So it is completely part of Centennial Care. Yes,
Very
sir.
good. I just thought that would be an important part that should be clarified. Do I understand that if rough numbers, we've already paid 4.5, was it?
4.7 for this current year.
4.7, okay, good, 4.7. We've paid 4.7, so the difference between 4.7 and the 3 would be the number of people that would sign up for the Centennial plan. Do I understand that correctly?
We've paid $4.7 million as our county match to Soul Community Provider, which is just the fixed amount that goes to each hospital. The $3 million is an estimate of what a 1/12 of the GRT is for what I'm hoping will be future funding of the safety net care pool.
And if I'm not mistaken, don't we currently fund this from it's called the second 1/8?
Correct.
So there would still be a difference that we're collecting, and what is that number between 1/12 and?
The difference between the 1/12 and the 1/8, depending on whose numbers I look at, is probably about $1.5 million.
Okay.
Because it's about $4.5 million that we get in the total 1/8.
And within that second 1/8, are we required by statute to provide specific services?
Yes, a lot of the specific services in so Senate Bill 268 amended the Indigent Care Act, and there are a lot of the language remained. So we still are required to provide indigent care for people who have no coverage, ambulance services, hospital services, substance abuse treatment. There's still a list of care that counties are obligated to provide.
Okay. So if the state dictated that the 1/12 would be for this fiscal year, then we should get a refund of 1.7? Is that the way I understand that?
That is an argument that I think we need to be ready to make.
Very good. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Rawson, any questions? Commissioner Garcia? Okay, thank you. I guess what I would just offer is that, number one, I appreciate the fact that this is an evolving sort of matter. I don't know if it's possible to have some kind of a white paper or something that is kept up to date and that we could access so that we would know not only what was being discussed and what had been agreed upon, but also what the implications are. I think that that's been one of the challenges. This is big money and important services, and being able to be clear about the continuation of the commitment by this board to providing those services. I think that that's part of what we want to make sure we understand. I think it's also important that in addition to whatever the manager does in terms of helping with discussions in Santa Fe, I would just say if there are any matters that need to be brought to the board in terms of resolution of support for certain approaches, I would entertain that. It's not unusual for this board to consider resolutions of support for particular kinds of things, and this is important. So if you need that, I simply want to put that out there that we would be, I don't know what kind of resolutions exist other than what we've been doing on a regular basis, but we're obviously in a period of change, and we want to weigh in terms of support for our hospital and for the services that are provided. Have anybody on the board that would disagree with that? I don't think so. I think I'm speaking generally for the board in terms of staying informed and being able to do what we can to help move things forward. So thank you very much for that presentation.
Thank you. And we
Mr.
will.
Chair, I'm sorry.
Yes.
I need to ask one more question. If something that Commissioner Hancock said was very interesting in regards to the $1.7 million, if we were to get the $1.7 million from the state, that's a big if. Could we use that funds to pay off our debt that we have right now, the $15 million debt that we have? I don't know if that's possible.
It is part of the second 1/8, so it's indigent tax.
Also,
We'll let our county attorney address the rules that govern that string of money.
Mr. Caldwell?
Mr. Chair, Commissioners, probably should clarify, it's not probable or likely that this board is going to see a refund. That $4.7 million, whatever that second 1/8 was that we forwarded, went to the state of New Mexico, which then notified the Centers for Medicaid that the state had $100 million available from all counties, and then CMS forwarded its matching funds, which I don't know what the ratio was this year. That money then came to the state of New Mexico. It was then distributed to the hospitals. That money has already been distributed to Memorial Medical Center and to Mountain View. It's not available for a refund anymore. So I think it's an interesting question, but it's not likely going to happen as to a refund.
Great. Thank you. I was just curious. Thank you very much.
Thank you. Commissioner Hancock?
Thank you, Mr. Chair. Then perhaps they could give us a credit on the $3 million that... Thank you, Mr. Chair.
We will be coming back to the board because as we revise the resolution, we're going to need some policy decisions on what types of services we cover as we move forward, where this money is going to come from and other things. But the bottom line for our county, I think financially is very positive. We were set with approximately a 3-to-1 match before. So we would put in $1, and the county as a whole, through the hospitals, would get a 3-to-1 match. Right now, the numbers that I've seen show that our return to our county is going to be more like a $1 to $8 or $1 to $10 return. So there are some counties that are barely going to get a 1-to-1 return because they don't have the same level of Medicaid billing. We are going to get a much better return as a county on our dollars. So we're going to be putting in less, and our hospitals, or the county as a total, is going to be getting back more, which is a nice position to be in.
Very good.
All right.
Anything else? Just one question. Are you saying that the safety net care pool title is likely to include both the uncompensated care and the hospital rate increase?
Yes, sir.
Okay, that's
Yes.
great. Okay, just want to make sure, because on our PowerPoint, it looks like it's two
Right.
things, but we'll be talking about both of them under that heading.
Correct, because we're not sure of the distribution mechanism back to the hospital yet. Those are the two pools of money, but we're referring to them all as the same safety net care pool program.
Got it.
All right.
Thank you.
Thank you.